The TMJ TMD conundrum is real and has been puzzling the dental and medical professions for decades. This is the TMJ TMD Demystified podcast with Dr. Tony Urbanic, where we'll connect the dots between TMD symptoms and the actual cause. We'll tackle common TMD misconceptions and educate you, the practitioner, about a simple, tested, and proven TMD solution that has already provided relief to thousands of patients, while helping practitioners build an additional source of income free from insurance control. Welcome to this episode of the TMJ TMD Demystified podcast.
Use the device itself and understand that the device is a tool to be used with a protocol, and that compliance from the patient and education is also extremely important to deliver to the patient by the doctor, by the network provider, for success of the device, and to limit the number of symptoms that the patient has as quickly as possible. So the first point is, I don't know how else to drive it home, but it's extremely important. And this is really misunderstood in a tremendous way. This thing is a tool. It's just a tool. Fits in the mouth. And there's so much misunderstanding about this. The patients think they're buying a widget, you know. I understand that. I understand the misunderstandings about that. That's why I'm trying to get rid of the misunderstandings, but certainly not a widget, and it has a certain set of properties to it. It does fit in the mouth, doesn't do anything inside the mouth. As you know, all this does is unload the joint to allow the inflammation to go away within the temporomandibular joint, which allows the symptoms to go away. But you have to use it as a tool. If you just use it any old way, you will not get the response that we know you can get. So just like I use it in talking to patients all the time, if you hold the screwdriver with the wrong end, you'll never get the screw to go to place. You don't know how to use the tool. So, and it's important that the patients and the doctors understand that this is a tool to use. And if you use it correctly, you'll get the response. So the first thing that I want to avoid, and we certainly try to avoid around here, is, you know, giving a patient this device as a tool without proper education. Now, we've tried to avoid that from the get-go as we develop the network of network providers that aren't in my office every day and get to listen to how I've developed this and use it. We have a package insert, which is not just to satisfy the FDA, but it is there for good reason by the FDA, so that all of the information regarding a patented device, or in some cases a drug or whatever, has a package insert, which tells you everything you need to know about the device. So in this case, the Urbanic device says here, Urbanic device instructions for use. It's very simple. I wrote this myself several years ago now, and as is custom and is necessary, required by the FDA, a copy of this set of instructions is inserted with the delivery of every device and in our office, and instructions are given to every network provider that when the patient says that they want to do this, and that impressions are taken before impressions are taken, emphasis before impressions are taken, the patient is given the opportunity to read these instructions before you ever fulfill the impressions, take the impressions, take their money, get impressions. Most of the patients do not want to read this before they take impressions, but they are given the opportunity that this is the package insert. these are what is necessary to do and know to use the device. So this is a very important document, extremely important document for many reasons. The biggest reason is the patients need to know all the details of what they expected them to do so that they can get patient compliance, good results with good patient compliance. That was why this document was written. It really hasn't changed in, I think this document is probably, well, ever since we got the FDA approval. So this document is now like 4 years old. I have no reason to change this. So everything that's needed to know from a patient's point of view about using the device is on this document, and they're given the opportunity to read it before they actually take impressions, and they are asked by me personally, and should be asked by every network provider when this device is delivered, to read this set of device instructions completely, cover to cover, before they ever start using it when they take it home. And that is part of my instruction sequence, which I think I've given to you in details how I deliver this sequence on other podcasts. So as the concept that we have to use it as a tool, you have instructions for the tool. It's pretty simple. And then you just have to do it consistently. That's the other part, the consistent part of it. You can't skip anybody. The second reason this is important is for doctors' liability. I've been a maxillofacial surgeon now licensed as a maxillofacial surgeon since 1976. You figure out the number of years, a lot of years. And during that years, I performed thousands and thousands of maxillofacial operations, intraoral, extraoral, facial reconstructions. And I learned early, right from the get-go, that it's important that you have liability insurance and that you're always concerned about your professional liability when you start taking somebody's face apart and putting it back together. Well, this translates into using a very simple, very inobtrusive, is that a word? Unobtrusive device that you still have to know things that can happen with that. And super eruption of posterior teeth is not one of them as far as adults are concerned, using it correctly according to the protocol. But this set of instructions, package insert, actually is an extremely important component of covering you and your professional liability in using this device. So point is, you got to use it. Very simple. So that's what the patient needs to know. It's in writing. You can emphasize some of the things on here, which I do. When I deliver a Urbanic device to a patient, the instructions are pretty simple. I tell them, I hold a little container in my hand, and I say, so this is what you need to do. You need to keep it in 24/7, except when you eat. You can drink with it in your mouth. Coffee, tea, soup, hot fluids are fine, but when you go to chew, you got to take it out. After you eat, you brush your teeth. You brush your device with toothbrush, toothpaste only. Put it back in your mouth. Always keep it in a case when it's out of your mouth, 100% of the time, because people lose it, break it, let the dog chew it up. Always, because it's out of the case, even for a split second. Patients come in and say, it's only a split second when it's out of my mouth, and that's all it takes. We don't want them to lose it. We don't want to have to do it again. We don't want to have further charges on the service, and they will appreciate that. And so those are the simple instructions that are part of this. There are other more technical things that I really don't need to go into. It's all in the package insert. But the emphasis on this episode is that it's a tool, and talking about emphasizing to the patient and in your own mind as a network provider that it's just a tool. You have to really understand the protocol that goes with it. Again, the protocol is well covered in other episodes. And The last point I want to make, and it's going to be a rather short podcast because I don't want to belabor this too long, because these are extremely important points to make, but they're extremely simple. And I don't want to bore you with it, but I think the last point is talking about patient compliance. You can't expect good results if the patient can't follow instructions. You know that from whether you do surgery or whether you do periodontal surgery, extractions, crown and bridge. There's certain instructions you want to give a patient. It's important to have completion of that service successful, and that's called patient compliance. So frankly, if the patient reads this and complies with the simple instructions, they'll get the result. Tripped me to think about all the other times I have seen patients and doctors contact me, did communicate one way or another with issues they were having that were all based on misunderstanding of the fact that this is a process. It's not an all or none, obviously. It's a process that goes on over a period of time using the device. And because inflammation takes a while to decrease, once you unload the joint and the inflammation starts to decrease, it takes a while. It's different in every patient. Every patient does not go at the same pace. They all go at different paces, and each symptom goes down at a different rate. So the decrease is a process that goes down at different rates for different people and different symptoms at different rates. That's kind of the process. And the protocol, it was worked out because it just worked best. At 24/7 for 2 months worked out very well. And as I discussed in many episodes prior, the main issue was, if you disocclude the posterior teeth, will you get super eruption? And the answer is absolutely no in an adult within 2 months. So you're safe within 2 months disoccluding posterior teeth. You're not going to get super eruption. It's not going to happen. But that's why the 24/7, we limit it to 24/7 for 2 months, and then nighttime only after that. With, as you've heard multiple times, then you go to nighttime, and they can wear it more during the day, but never 24/7 again. They can wear it an extra 6 or 8 hours a day. The general dentist actually is the most likely to treat or to at least see patients with TMD. And so this third episode in the series is devoted specifically to the general dentist, and I'm trying to bring all of the information together in one location as it applies to the general dentist. So although I may speak about topics or things that are relevant to an oral maxillofacial surgeon or an orthodontist within today's topic, I'm really directing it specifically to the general dentist. Just to recap the general nature of the whole podcast over the past year and a half, is that we and I, starting 11 years ago, figured out what everyone else hasn't figured out about TMD, and actually is ignoring. And to this day, it stymies me to think about how it's totally ignored in the different directions that professionals and providers are going on to treat TMD. And we'll just leave it at that for the time being. But I'm doing my very best to describe for my fellow colleagues in all professions, medical and dental, as best I know how, about getting them oriented on understanding TMD in the most simplified way, so that they can apply this information, so they can actually treat the patients predictably and correctly, and get great results using a device that we had to call the Urbanic device for lack of better terms, which takes the load off the temporomandibular joint, and a protocol to go along with it.